Renal vein thrombosis usually happens in the setting of nephrotic syndrome. This is because you have urinary loss of anticoagulant proteins, and what happens is you have an alteration of hemostatic balance. If the patient does not have nephrotic syndrome, then that means it can be because of acquired hypercoagulability, which is really associated with malignancy or even trauma. Now, if the patient doesn't have nephrotic syndrome or any type of malignancy, then don't forget to think about drug-induced risk factors like oral contraceptive pills. Clinically, the patients can present with hematuria, they're peeing out blood, they have flank or abdominal pain. On lab, you want to see elevated LDH, and sometimes even on imaging, you'll see enlarged kidneys. In order to diagnose, you want to get a CT or MR angiography, or you can do a renal venography. You, of course, have to anticoagulate the patient for treatment, and also thrombolysis or thrombectomy would be necessary if you have acute kidney injury present. On rarer occasions, but of course, USMLE really likes testing, don't forget that antiphospholipid syndrome can cause a hypercoagulable state, and as a review, it's a systemic autoimmune disease and it's characterized by these thrombotic complications, and a lot of these patients have persistent antiphospholipid antibodies. They also present with levoreticularis or thrombocytopenia and also valvular heart disease. These antiphospholipid antibodies include lupus anticoagulant, and what it does is it prolongs your partial thromboplastic time, or your PTT. The other antiphospholipid antibody are the anticardiolipin antibodies, which are IgG or IgM, and these are the ones that test false positive for syphilis.